Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Middle ear and its diseases. So first we're looking at the OME. OME stands for the otitis media with the effusion. So it is also known as, the other names are glue ear. So other names it includes glue ear. So there is glue ear. Next is the secretory, as well as there is serous. So there is glue ear, there is secretory, there is serous, as well as a mucoid otitis media. So there is glue ear, secretory, serous, mucoid, otitis media. Otitis media. So what will be the pathology here? The pathology is there is a fluid in the middle ear. So simply there is a fluid. So simple reason being fluid which is present in the middle ear. Now, next we look at the ASOM. So the ASOM, this ASOM stands for the acute suppurative otitis media. There is acute suppurative otitis media, and it is also known as the acute otitis media, AOM. So what is the pathology here? The pathology is that there is a pyogenic inflammation of the middle ear cleft. So there is a pyogenic inflammation of the middle ear cleft. So this is nothing but the ASOM. So ASOM will have a middle ear cleft defect, and there is a pyogenic inflammation. So the duration here is going to be less than 6 weeks. Then comes the CSOM, chronic suppurative otitis media. So chronic suppurative otitis media, the pathology is that there is a pyogenic inflammation of the middle ear cleft. So it is same as that of the ASOM. So the pyogenic inflammation of the middle ear cleft. So we are writing it as MEC, and with the perforation of the tympanic membrane. So with the tympanic membrane, TM perforation. Now what will be the duration? The duration will be greater than 6 weeks. So duration is going to be greater than 6 weeks. Next, we move on to, before that we need to know that ASOM was less than 6 weeks, this is greater than 6 weeks, and pyogenic inflammation in the middle ear cleft was common in both, and there is a perforation in the tympanic membrane in terms of CSOM. That is a chronic suppurative otitis media. Next we move on to the recurrent otitis media. So recurrent otitis media is nothing but the ROM. So ROM is the recurrent otitis media, and the pathology here is that there is a pyogenic inflammation of the middle ear cleft. So there is a pyogenic inflammation, and this is of the middle ear cleft. So the recurrent otitis media is same as that of the ASOM. So here there are two kinds of durations. That is, it may occur as greater than equal to 3 episodes. So it may be greater than equal to 3 episodes, and this is within 6 months. So this will be within 6 months. Or the other condition is greater than equal to 4 episodes. So this is greater than equal to 4 episodes, and this is within 12 months. So this will be within the 12 months. So next is, we move on to the aero-otitis media. We move on to the aero-otitis media. So aero-otitis media, or the otitic barotrauma. So otitic barotrauma. So there is aero-otitis media as well as the otitic barotrauma. So the pathology here is there is a barotrauma to the middle ear. So we are calling it as BT to the middle ear. So barotrauma to the middle ear. To learn and grow daily like this, please do subscribe.